Over here looking like I'm about to bust your mother's walls down like the Kool-Aid man.
Thank you.
You will. Hey, how you doing, Dr.
Hi,
Chen?
how are you? I like your color.
Oh, thank you.
Yeah, you're
It was
a
supposed to
Rangers
be-
fan, huh? So it looks like, as you've probably been told, you have what you call an aneurysm. Aneurysm is basically an abnormal dilation of a blood vessel, and basically it's in a artery that supplies blood flow to your liver. Now, your liver actually has multiple different blood vessels that actually supplies blood flow.
Okay.
And it's a little bit unclear, based on the CT scans that you've had thus far, to kind of see the full anatomic delineation of this aneurysm and how many blood vessels are coming out. Because the scan that you had was I think they were more looking for other things, right? It wasn't really just to look for the aneurysm.
It was for a blockage. They found the aneurysm
Incidentally.
through looking for the blockage.
Right.
You know.
Yeah. In order to kind of decide what may be a best treatment option to treat this aneurysm, we need to kind of figure out, where the branches are coming out. Because if there are branches coming out, we may have to sacrifice them.
Okay.
And if that's the case, we need to know how much of these blood vessels are supplying blood flow to your liver.
Okay.
The good thing is about 55% of your blood flow to the liver is supplied by what's called a portal vein,
Okay.
which is not artery actually.
Okay. So that's good.
So it's actually, liver is one of the very few organs in your body that you get blood flow from the vein. So typically, normally speaking, arteries are the blood vessel structures that supply blood flow to organs.
Yeah.
Veins are the blood vessels that drain the blood from the organs back to the heart.
Okay.
Does that make sense?
Makes sense.
So you would imagine if this was a spleen artery, the
we got
arteries would
company.
supply blood flow.
Sorry, I'm interrupting. I just wanted to say hello. I'm
Hi,
Dr.
how you doing?
Rockman.
Hi,
are
how you doing, Dr. Rockman?
Dr. Lee told me a lot about you,
Yes.
and Dr. Cheng and I have worked together for many, many, many years.
Okay.
So we've reviewed the films, and we have a plan for you.
Oh, that sounds good to me because a
Are
plan.
you ready for Heart Day?
Yes.
And I'm not even ready for Heart
See,
Day. Now
I'm over here
embarrassed.
supporting,
I'm embarrassed.
and it's
I
not even a
forgot.
heart problem I got.
I forgot. I'm totally embarrassed.
See, I told you, Tart Day. Where's your red?
Someone already
You
yelled
want my
at me.
Ranger set?
Someone yelled.
You know.
Okay. It was good to
Thank
see
you so much,
I'm
Dr.
gonna leave you
Rockman.
in good hands.
I like the attitude.
Thank you. Listen, it makes it so much more worse if you act any other way, So
Right.
you got to be positive about it.
No. The reason it's important because some of the blood vessels, you have multiple different blood vessels that may serve the same purpose.
Yes.
And if you sacrifice one of these, you probably won't have any major, sequela as a result of the blockage, because all these blood vessels have some degree of a purpose, right?
Absolutely.
But if they have a shared job and you just get rid of one of them, the other is gonna, pick up and do the work, right?
Yes.
So you're not gonna have any problems. In those cases, we may just block up this artery so that you don't get blood flow. Because the main, complication you can develop is that it can rupture and you can bleed to death.
Yeah.
Based on your size, typically the recommendation is, usually 2.5 to 3 centimeters is the cutoff for, thinking about a potential intervention so that we can mitigate your risk of this rupturing. Despite that, at 2.5 centimeters, which is kind of your size criteria right now,
Yeah.
the risk of rupture is probably less than 2%. So it's
Okay.
very low.
Okay, so at least that gives me a good mental. Every time I have a gas in my chest, I feel like it's the end. I'm saying my last rites,
Right, and sometimes, possible. But I think that's something that we can determine once you get the CT scan based on, how many blood vessels are coming out, what are distances from where it starts to the end,
Okay.
and what are these blood vessels supplying in the liver, right?
Okay.
And if we are able to kind of stay minimally invasive approach, what we do is, we place a needle into the groin artery. Sometimes we have to go through the arm artery, but either way, it'll be almost like an IV that you would get, in order to get the CT scan.
Okay.
Through the IV needle, we actually do the procedure. So it's kind of like how people have stents in the heart.
Yeah.
So we may not be able to cut you open to do this procedure. Certainly, there are times, based on how everything looks, we may not be able to approach it, that minimally invasive
Intravenously.
approach. Right. But if you can, that probably would be much better for you, given that your history of Crohn's, because that's gonna, any surgery that you have is gonna cause more inflammation over time.
Absolutely.
And it's gonna, really scar a lot of the.
Will I be out for this?
Most likely, yes. I would strongly recommend, putting you out. And that would be really because if, in the process because these blood vessels are quite small and there are a lot of branches coming out. Say we have a wires and catheters in one of the vessels, and say you cough and move around.
Yeah, I'd rather
and if
be
it
out.
moves and perforates one of the blood vessels, now we're dealing with, bleeding, right? So
I'd rather be knocked out, to be honest
I think
with you.
that's. I'm not telling you that's what you need, but
Yeah.
at least have a sense of what are the options available. There are really two main ones. One is endovascular or minimally invasive approach, where we insert the needle, and then we actually deliver a wire and catheter into that aneurysm.
Okay.
And over those wire, we could either deliver these coils that can block up that blood vessel, so you're not getting blood flow, so it doesn't rupture in the future, or we can, if the length is appropriate and the blood vessels before and after the aneurysm is pretty uniform, we can also deliver a stent. And the stent actually has a fabric outside so that you basically get an artificial blood vessel.
Okay.
In the form of a stent.
Okay.
So it's placed inside your artery.
Is that invasive too, or?
No, that's the same approach.
Okay.
It's just two different means of kind of depressurizing the aneurysm. So
And what was the third option that you were talking
third
about?
option is open surgery, traditional open surgery. Say if you had this problem 20 years ago, we wouldn't be talking about this minimally invasive approach. Everyone would get the same surgery. So what will happen is that we either have to resect this aneurysm and replace it with vein as a conduit, so that you can continue to get blood flow to the liver.
Right.
Assessment of which blood vessels are giving you blood flow to what liver, or like what part of the liver.
Yeah.
So that we can kind of estimate, if you sacrifice this artery, how much of that is going to compromise your flow to the liver.
Okay.
And if it's it's like 20 to 30%, that's usually okay, because again, as we talked about, your liver actually will grow more tissues over time.
Yeah.
And you would have existing. I mean, you wouldn't even know that part of this arteries were sacrificed.
Oh, for real? Yeah.
Yeah. It's not just a regular CT
Now,
scan.
after this procedure, right? I'm
Yeah.
not going to need to be on any medications or anything like that, right?
So that's actually a great question. So say if you just block up this blood vessel entirely, if you know that this is serving minor portion of your liver blood flow, then we can block it up. If that's the case, you don't have to take any new medication. In case we have to place a stent, then we have to put you on a medication called aspirin and Plavix. And these are the medications, because what happens is that stent is not something that typically belongs to your body, right? But sometimes we have to put it in the heart to give better blood flow. In your case, it's not so much to give better blood flow. It's basically serves as a new blood vessel inside the blood vessel,
Yeah.
so that you don't get all this pressure into the aneurysm.
Okay.
Because aneurysm, if you continue to get pressurization, it can get bigger and rupture eventually.
Yeah.
I mean, the fact that the size hasn't changed, over the course of the last, 6-7 months is quite reassuring.
Yeah.
This is probably, if anything, very slowly growing aneurysm. There
Which
are
is good.
aneurysms which grows very quickly, say within like a month or two.
Oh, wow.
The reason that we have to put you on these two medications, and you would take those two medications for at least 6 months, and then after 6-month period, it would drop one of the medication, and then the other one you have to take it for the rest of your life. And the reason that we have to take this medication is a stent, which is not something that belongs to your body tends to attack it over time. And those happen more frequently in the first 6 months. And when they attack it, they block up this stent. If we have to put stent instead of blocking it up, that usually indicates that blood vessel is vital for your liver.
Okay.
If the stent gets blocked up, you're not getting blood flow to the liver.
Yeah.
That's going to cause a problem with your liver function.
Okay.
So that would be the rationale for taking the medication, so that we can keep that stent.
And then
Okay.
we will get the prior up. I'll give them a call.
Yeah.
You can get the blood work as soon as today if you want.
Okay, could
I'll
I?
give you a script and I'll tell you
Yeah.
everything when the doctor
Yeah,
says.
you just
Okay.
have to go down to the 4th floor, and then you can get it done. I mean, as soon as possible. The reason I don't put the date in mind, because if the insurance says, "Look, everything's approved," within a day or two, then you may be able to get it as early as next week, and you can file it with me after.
Yeah.
If they say we have to give you a week or something, because we don't always know how they're gonna respond to this.
Yeah.
So, as soon as it's done, you can come back to see me, and then we can sit down and talk about where to go from there.
Okay.
Okay.
Sounds so good. Thank
All
you,
right.
Dr. Chen.
Nice seeing you. Okay. Have
I
a good
really
rest of the day.
appreciate it.
And
Thank you so much, and enjoy your weekend.
you as well. Okay.
Boy, was that a lot of motherless information. Listen, they already got the CAT scan cleared, so tomorrow I go back.